been on and off Medicaid my entire adult life. I've had symptoms including chronic migraines, shortness of breath, fatigue, insomnia, and cognitive decline since I was 3 years old. Nobody could explain why I had these symptoms, and medical professionals did not believe me when I said I was experiencing these things. After fighting for 20 years, I was finally diagnosed this past October with neurocardiogenic dysautonomia. Basically, this means that the things my body's supposed to do automatically to regulate itself it doesn't do it. I have chronic insomnia that started when I was just a toddler. I remember getting in trouble for not sleeping almost every night during primary school. I remember I eventually got onto a medication in adulthood that allowed me to get some sort of sleep. But 5 years ago, my Medicaid managed care plan through United Healthcare got moved over to United Healthcare. UHC said that the sleep medication I'd been on for years to manage my chronic and severe insomnia wasn't covered.
That ain't right!
The only alternative they suggested to me was a medication meant for those with acute onset of insomnia precipitated by a traumatic event that's expected to last no longer than 5 to 7 days. Which is fancy speak for people that are suffering short-term insomnia due to something bad that just happened to them. And it's not supposed to they're not expected to have sleep disturbances for any longer than a week. The manufacturer's website for the drug warned that it's absolutely not to be used for any longer than 1 week. But the person I was speaking to at the insurance company didn't want to hear it. Without medication, I will go days without being able to sleep. These companies have so many of us convinced that because we struggle to pay for healthcare, that we're the bad people, that it's our fault that we're suffering. They're counting on our shame to keep us silent. But I'm here to say that I won't be silent anymore. We won't be silent anymore. This is a systemic problem. And we are coming together to demand that these insurance corporations stop denying our care and that lawmakers hold these predatory companies accountable for how they are treating us.
We are calling you to demand change. I know what it feels like to have medically recommended procedures denied pre-authorization, dangerously resulting in delayed care. That ain't right.
That ain't right.
I know what it feels like to have medical debt because of denied claims. That ain't right.
That ain't right.
I'm here to add my voice to the thousands of others across this nation who've had enough of paying high premiums, deductibles, and co-insurance, or whatever else they want to call it, only to be denied access to healthcare professionals and recommended treatments. Gatekeeping and profiteering at our expense must stop now. Be transparent about denied claims and money value. Share complete details around these demand claims and denied prior authorizations by market, state, geography, gender, and race.
That's right.
Share the monetary value of total denied claims and denied pre-authorizations.
Yeah.
3, be transparent about how much denials drive your profits. Share the total percentage of profits taken by denying care to us, your members.
Yes. That ain't right.
Hold monthly open mic meetings. Don't be afraid. Meet with policyholders regularly to discuss problems with your insurance products. You call us consumers, you best listen to us. Number 5, put the appeals process in public hands. Relinquish ownership of and transfer over the claims and appeals process to relevant public authority.
Healthcare is a human right.
Fight, fight, fight.
Healthcare is a human right.
Fight, fight, fight.
At
companies making my healthcare decisions for me.
That's right. Ooh, that ain't right.
It ain't right.
Because without insulin, I die. It's life or death for me. And we know that everyone deserves quality healthcare, regardless of their race, gender, income, or zip code. These corporate insurers make billions with a B, in profits every single year at our expense.
That ain't right.
They overcharge us for premiums, deductibles, and co-pays.
That ain't right.
That ain't right. They deny us the care that we need just so that they can fill their pockets.
That ain't right.
These insurance companies deny hundreds of millions of treatments every year just because they can.
That ain't
And the more they deny, the more money they make. There is no reason why these corporations and CEOs should be making record profits during a fucking global pandemic. They raked in $238 billion in profit at the height of the pandemic while we were fighting for our lives. So we are here today to expose the greed and cruelty behind these health insurance companies which claim to be helping us. We know it's bullshit.
Bullshit.
I struggle with endometriosis and scoliosis. Endometriosis is a disease that leaves me in debilitating pain every day. Fever, diarrhea, fatigue, flare-ups. It's very unpredictable and I can't live with it, but I have to struggle every day. The city I live in, Hartford, is largely black and brown, but lacks dental and oral health centers in black neighborhoods. The providers who are in proximity do not accept Medicaid. I have to travel out of town for services by finding a ride, catching an Uber, or taking the bus.
That ain't right.
To costly dental expenses. In September 2020, I went in for what's supposed to be a filling. I sat down and was injected with numbing agent. The dentist started to drill, then suddenly stopped. They told me I needed a root canal instead of a filling. Okay, I agreed. They said it would cost over $2,000.
That ain't right.
Then they asked me how I was going to pay for it, because they wasn't going to credit it. No, I had no credit, and I did not have $2,000, and they refused to finish until I paid.
That ain't right.
So I was sitting there texting my friends, trying to find money. I'm a good fundraiser, luckily. And you know, my friends sent me over a couple of dollars to borrow. But almost an hour passed. I was sitting there thinking that my tooth was gonna unnumb with my nerves exposed, tooth open, scared as hell, head bent back, in pain, waiting for them to make a decision while they went back and forth to see other patients who could afford their care, who qualified and could afford health insurance.
America's health insurance plans puts their profits over our lives, and that ain't right.
That ain't right.
They've been exploiting the system for far too long. We're living in a crisis, and we need to call the shots. People's Action fought alongside me to get the up-to-date medical devices and insulin, which I need and deserve to live a full and healthy life.
Yes, you do.
People's
We all
Action
do.
and Iowa CCI and myself, we stood up and we said no to my private insurer. And we're not going to take it any longer because we know that there's a better way.
Yes.
Right? We got our own agenda. Because the people closest to the problem are the closest to the solution. So, what are we going to do? We're going to fight back. We're going to stand up. We're going to show solidarity for everyone. Because everyone deserves health care, no matter what. People's Action and Iowa CCI stood with me when I couldn't get my insulin. And we will stand with all of you, every single one of you, when they deny you the care that you deserve. We have the power. We already have the power. We know that, right? All we have to do is stand up together, reach out, and take it back.
One of the few things I can do to increase my chances of survival is to treat the NMOUs so that I can get off of artificial feeding, which will further decrease my risk of infection. Treatment will allow me to eat real food, regain strength in my body, build up my compromised immune system, and eliminate cancer-like pain. This will allow me to function a little bit better and take care of myself more easily and effectively. Unfortunately, because the surgery takes place out of state, United Healthcare denied the surgery and made it impossible for me to appeal it. This left me with debt, and the surgery would be between another $50,000 and $80,000 more.
That ain't right!
As a disabled individual dependent on disability, there's no way I could ever pay for all of that. So I had no way to get the surgery. And if the insurance wasn't going to give the okay, the surgeon was unwilling to schedule me for surgery. And I'd be looking likely at a short life, spent in debilitating pain and suffering. United Healthcare made it impossible for me to actually make any progress through the appeals process. I spent countless hours calling United Health, only to be told different things and tossed around in circles so we couldn't get anywhere. I tried everything. I cried. I became demanding. I requested supervisors over and over and over, and I never got anywhere, still sick with the same disease and pain, desperate for treatment.
I worked in healthcare for over 26 years, and things were bad when I started, but they are much worse now. I worked in medical coding, billing, and collection. Not collections from patients, collections from insurance company who denied our patients' claims. I supervised 40 people, all spending hours every day filling out endless paperwork and getting on the phone to argue with insurance companies. 40 people. I took care of the cancer people who were often confused and terrorized because their treatments were being denied for some incomprehensible reason.
That ain't right!
That ain't right!
I would reassure them, tell them to continue their treatments, and get on the phone with the insurer and fight and argue until we eventually got paid so that the patients didn't get stuck with these bills. Only in the U.S. do people go bankrupt from medical bills.
That ain't right!
For-profit healthcare is a social disease that has reached pandemic proportions. In the richest country the world has ever seen, is healthcare a privilege for the rich or the right of every citizen?
That ain't right!
The U.S. pays much more per capita than any country with national health. We pay more, but we receive far less, and why is that? Just two words: corporate greed.
Your greed makes us sick!